The screening is a method of identifying um, in the general population where a health problem or a condition is at higher risk, and then it will lead to early intervention or early treatment will result in a better outcome to the patient as a general. So there's multiple types of screening that are available. One is a mass screening, where everyone got admitted into the screening program. One is a opportunistic screening, where is for example in our country, where a patient come in with another symptoms and we screen for a specific type of disease. And then there's a community-based screening, where we do targeted in the screening population, and then there's targeted screening where the certain type of race or a kind of population where we screen for certain diseases. So why the aim of the screening is to reduce the mortality and also morbidity of the disease itself, and then secondly is to reduce the incidence by targeting the precursor of the disease, so the early treatment should be available. And then lastly, it will be reduced in the cost of burden to the country itself. So next is there's a principle of screening that be proposed by Wilson and Jungner. They say that the disease itself must be heart problem. Secondly is there will be a treatment and also the diagnosis, and also there's a facility to overcome this. And then natural history of the disease must be known. And then the early phase or latent phase of the disease is already been recognized. And then subsequently, the test itself must be easy and also acceptable to be used by the community. And then there will be a policy makers acceptable, and then who should be treated and should be admitted into the program itself. So disease screening should be a continuous process and should not be a one-off process. So that's actually a benefit, also the harmful of screening program. The benefit, as I already mentioned, and also the harmful, patient can be false positive result, where patient can have over-diagnostic or over-investigate, and then causing a psychosocial effect to the patient. Then secondly is the patient have this false negative result, where patient time will be negative, and then subsequently later on in life develop an advanced disease stage. Secondly is the overdiagnosis, where a patient will be screened for another disease and come up with another disease that will be a benign disease that will not be harmful to the patient. And then lastly is overtreatment. So when screenings have been done, like for example a prostate CA, early diagnosis will be done, and then treatment like prostatectomy will lead to another complication like incontinence, like erectile dysfunction. So for example in our country there will be two major screening program. One is breast cancer screening and also colorectal screening. So this is opportunity screening, where patient would come for another disease and we screen for that disease. Or for example in next month there will be a breast screening, breast awareness campaign. So a screening will be done according to the organization. So with all, thank you.